Hello, everyone, and welcome. I'm delighted to see you all here today. We will be discussing fluid therapy for critically ill dogs and cats. My name is Dr. Malik Abu Rafi, and I hold a BVSC, MVSC, and PhD in veterinary surgery and radiology. In this presentation, we'll explore the essential aspects of fluid therapy, including indications, techniques, and best practices for managing critically ill patients. I look forward to sharing valuable insights and engaging with you throughout this session. Today, I want to talk about the aims of our critical tools in small animal emergency care. First and foremost, these tools are essential for restoring and maintaining hydration. When an animal is in distress, ensuring they stay properly hydrated is crucial for supporting their overall stability. Next, we focus on correcting electrolyte imbalances. Electrolytes are vital for many bodily functions, and imbalances can be dangerous, especially in emergency situations. Addressing these imbalances helps prevent further complications. Supporting circulation and oxygen delivery is another key goal. Efficient circulation ensures that oxygen reaches all the tissues, which is vital for recovery and survival. Lastly, these tools allow us to deliver medications effectively. Whether it's antibiotics, pain relief, or other necessary drugs, having a reliable method to administer medications quickly can make all the difference in an emergency. Overall, these aims highlight how our critical tools are integral to stabilizing and saving small animals during urgent situations. Let's take a closer look at the body's water compartments. The total body water, or TBW, makes up about 60% of your body weight, which is quite significant. Now, this water isn't all in one place, it's distributed across different compartments. About 2/3 of this water is found inside the cells, which we call intracellular fluid, or ICF. This is where most of the cell's metabolic activities occur. The remaining third is outside the cells, known as extracellular fluid, or ECF. The extracellular fluid itself is further divided. Roughly 3/4 of it is in the interstitial space, the fluid surrounding the cells, while about 1/4 is within the blood vessels, which we call intravascular fluid. Understanding these compartments is crucial because they play key roles in maintaining balance and facilitating processes like nutrient transport and waste removal. It also helps us appreciate how fluid shifts can impact overall health. Let's take a closer look at the different routes of fluid administration. First, we have the oral route, which is suitable for mild dehydration, especially in neonates. However, it's important to avoid this method if the animal is vomiting or at risk of aspiration, as fluids might not be absorbed properly or could cause complications. Next is the intraperitoneal, or IP, route. This is often used in emergency situations when intravenous access isn't possible. But remember, it's contraindicated in cases of abdominal disease, so we need to be cautious about that. The intraosseous, or IO, route is particularly useful in small animals or when IV access is difficult. It's especially effective for animals under 5 kilograms because it functions like a vein, providing rapid fluid delivery. Common sites include the subtrochanteric fossa, tibial tuberosity, and ilium. Then there's the subcutaneous, or SC, route. This is good for mild to moderate dehydration, but it's not effective in large dogs or in cases of severe hypovolemia because absorption can be slow and insufficient. Finally, the intravenous, or IV, route is often the go-to for critically ill animals. It allows for rapid and controlled fluid delivery, which is crucial in emergency situations. However, we need to be mindful of risks like phlebitis or fluid overload, so careful monitoring is essential. Understanding these routes helps us choose the best method based on the animal's condition and the urgency of rehydration. When we talk about types of fluids used in medical management, we generally categorize them into crystalloids and colloids. Let's start with crystalloids. These are solutions that contain small molecules, and they move freely across cell membranes, which makes them versatile for different clinical situations. Within crystalloids, we have isotonic solutions, which have an osmolarity close to blood plasma, about 290 to 310 m-osm per liter. For example, lactated ringer, or LRS, is often used to correct acidosis and is quite common in practice. Then there's 0.9% sodium chloride, also known as normal saline, which is typically used for hyponatremia or metabolic alkalosis. Another example is a mixture like 2.5% dextrose in 0.45% saline. This is mainly used for maintenance fluids, especially when potassium is needed, because it provides both energy and electrolytes. Moving on to hypotonic solutions, D5W, or dextrose 5% in water, is used in cases of hypernatremia and as a carbohydrate source. But it's important to remember, it moves quickly into cells, so it's not suitable for resuscitation where rapid plasma volume expansion is needed. Now, hypertonic solutions like D5NS or 7.5% saline are used mainly in shock situations. Because they are hypertonic, small volumes can quickly restore blood pressure by pulling fluid into the blood vessels. Switching gears to colloids, these are solutions that increase plasma oncotic pressure, helping retain fluid within the blood vessels. Plasma itself is used in cases of hypoproteinemia, where protein levels are low. Dextrins can improve microcirculation, but they may also impact coagulation, so we need to use them judiciously. Lastly, Hedastark provides long-lasting plasma volume expansion, but should be used cautiously because of potential side effects. Overall, these colloids are valuable in hypoproteinemia and shock, where maintaining blood volume is critical. Understanding these fluid types and their specific uses helps us tailor our treatment plans effectively, ensuring we match the right fluid to the patient's needs. Let's now look at how we calculate fluid requirements. When dealing with dehydration, we use the formula: percentage of dehydration multiplied by body weight in kilograms, then multiplied by 1,000 to get the amount in milliliters. This helps us estimate how much fluid the patient has lost. For maintenance needs, a general guideline is about 50 to 60 milliliters per kilogram per day. This covers basic hydration needs for normal bodily functions. We also need to account for ongoing losses, such as those from vomiting, diarrhea, or increased insensible losses. These should be added to the daily fluid requirements to ensure proper rehydration. Now, there's a special rule to keep in mind. When replacing dehydration deficits, we typically replace 25 to 50% of the lost fluid over the first 2 to 4 hours. Then, we aim to replace the remaining 80% within the next 24 hours. This staged approach helps avoid complications from rapid fluid shifts. Overall, understanding these calculations and rules is key to managing dehydration effectively and safely. Let's talk about dehydration levels and how we can recognize them. When dehydration is less than 5%, there are typically no clinical signs at all, so the animal might seem perfectly normal. As dehydration increases to about 7 to 8%, we call this moderate dehydration. You might notice dry mucous membranes, a slight skin turgor loss, and a CRT, capillary refill time, of around 2 to 3 seconds. The eyes may begin to appear slightly sunken. Now, when dehydration reaches about 5 to 6%, it's considered mild. Here, the mucous membranes become tacky, and there might be a slight skin tint or dullness. Moving into severe dehydration, which is around 10 to 12%, the signs become much more serious. You'll see a pronounced skin tint, CRT longer than 3 seconds, and the eyes appear markedly sunken. Cold extremities might also be present, indicating compromised circulation. Lastly, if dehydration reaches 12 to 15%, we're looking at obvious shock and the risk of imminent death. At this point, the signs are very severe: significant sunken eyes, cold extremities, and the animal is in critical condition. Recognizing these signs early is crucial because they guide our intervention to prevent progression to more dangerous states. Understanding these stages helps us respond appropriately and tailor our treatment strategies. Let's go through this example to understand how we calculate dehydration needs in a small animal case. So, here we have a cat weighing 4 kilograms. and it's estimated to be 8% dehydrated. First, we multiply the body weight by the percentage of dehydration. 4 kg times 0.08, which gives us 0.32 liters, or 320 milliliters. This is the total dehydration deficit. Now, over the next 2 to 4 hours, we should replace about 80 to 160 milliliters of this deficit to correct the dehydration gradually and avoid overload. Then, the remaining amount should be replaced over the next 20 hours. Another important point here is potassium supplementation, especially in cases of hypokalemia. The maximum permissible dose of potassium is 0.5 milliequivalents per kilogram per hour. To calculate the amount of potassium chloride to administer, we multiply the weight by this dose. 4 kg times 0.5 mech/kg/HR equals 2 mech per hour. Considering the concentration of KCl solution, which is typically 20 mEq per 10 ml, we can determine the volume needed. So 2 mech divided by the concentration, which is 20 mEq per 10 ml, gives us 1 ml of KCl solution per hour. This calculation ensures we provide safe and effective potassium supplementation during rehydration. Understanding these steps helps us tailor fluid therapy accurately and prevents complications. Now let's talk about emergency shock management, focusing on dogs and cats. For dogs, the typical approach involves administering 20 to 40 milliliters per kilogram of IV fluids over about 15 minutes. If needed, this can be increased to 70 to 90 milliliters per kilogram over the course of an hour. The goal here is to restore circulating volume quickly, but carefully. For cats, the initial fluid rate is lower, around 10 to 20 milliliters per kilogram IV, given over a similar short period. If the situation requires, you can escalate to 30 to 50 milliliters per kilogram over an hour, again aiming to stabilize the patient effectively. Throughout this process, it's crucial to monitor the patient closely. Keep an eye on heart rate, respiratory rate, and urine output, checking these every 15 minutes. This vigilant monitoring helps ensure we're giving fluids safely and adjusting our approach as needed. Remember, the key is balancing rapid volume resuscitation with careful observation to prevent complications. This approach aligns with our overall goal of providing timely and effective emergency care. Let's talk about some special situations we might encounter during fluid therapy. First up is anemia. When managing anemia, it's crucial to avoid giving large fluid boluses all at once. The reason is that rapid infusion can increase the risk of fluid overload, which we definitely want to prevent. Instead, it's better to use blood products along with isotonic fluids and administer them slowly and carefully to avoid complications. Next, we have extracellular fluid volume excess, which we often see in conditions like congestive heart failure, liver disease, or when there's significant protein loss. In these cases, the key is to use low NA+ solutions and monitor the patient closely. This helps prevent worsening edema or other issues related to fluid overload. Then there's vomiting and diarrhea. These scenarios require correcting both fluid and electrolyte imbalances, but it's important to base the treatment on the specific loss pattern. Typically, LRS, lactated Ringer's solution, and potassium supplements are often needed to replenish what's lost and restore electrolyte balance. Overall, understanding these special situations helps us tailor our fluid therapy carefully, ensuring we support the patient without causing additional problems. Thank you so much for being here today. I truly appreciate your time and attention. I hope the information we've discussed has been insightful and useful for your purposes. Remember, the key points we've covered highlight the importance of understanding the core concepts and applying them effectively. Connecting these ideas to the bigger picture is what drives success and innovation. If you have any questions or want to explore these topics further, please don't hesitate to reach out. Once again, thank you for your engagement and participation. I look forward to seeing how you implement what we've discussed.